Welcome to our series, an Overweight and Obesity series, sponsored by Aruka Seventh-day Adventist Church Health Ministries Department 2021. Today, we'll be looking at obesity and illness, and I am your presenter, Alicia Charles Thomas. Our objectives for today are to explain the consequences of obesity and to discuss the correlation between obesity and various illnesses. Consequence of obesity. Obesity contributes to poorer mental health outcomes, a reduced quality of life, and is one of the leading causes of death worldwide. Obesity affects our health in many different ways. Some of these are high blood pressure, type 2 diabetes, and these two conditions are two of the most common comorbidities in Trinidad and Tobago and the Caribbean. Obesity contributes to causing stroke, high or low cholesterol levels, coronary heart disease, gallbladder disease, osteoarthritis, which is a breakdown of cartilage or bone in the joint. It contributes to mental illness and exacerbates mental illness such as clinical depression, anxiety, and other mental disorders. It also causes sleep apnea and breathing problems, body pains and difficulty with physical functioning, and cancer. Let's look at obesity and hypertension. Now, many persons believe that hypertension is hereditary, but persons who become obese can also put themselves at risk of becoming hypertensive. When someone is obese, what happens? The healthy artery begins to develop fat in that space, which causes increase in the fat mass within the arteries, increase in your cardiovascular risk factors such as hypertension and hyperlipidemia, and it causes hyperplasia within the artery. If you look at it here, and it also causes arteriosclerosis or hardening of the artery. This leads to heart disease and cardiovascular endpoints such as myocardial infarction, stroke, and death. We can also see that in childhood, if children are obese, they are also at risk of becoming hypertensive. However, we'll talk about childhood obesity in our next series. To avoid obesity for persons who are obese at the moment and at risk of becoming hypertensive, what we need to do is look at diet and lifestyle, counseling and modification of your lifestyle, right? So we need to look at what we eat and how we exercise on a daily basis. Let's look at obesity and sleep apnea. Obesity is one of the most powerful risk factors of sleep apnea. However, it is also one that can be reversed. In persons who are obese, if we look at the back of the neck here, this fatty tissue here becomes even more fatty and causes blockage of the airway when persons are asleep at night. And this blockage of the airway can lead to death. Although there are other conditions which contribute to sleep apnea, such as hypertrophic tongue, nasal fossa closure, soft palate, which is smaller, or hypertrophic tonsils or enlarged tonsils, fatty tissue at the back of the neck, because of its location, is one of the most dangerous risk factors of sleep apnea that can lead to death. Let's look now at obesity and type 2 diabetes. Type 2 diabetes is caused by an increase in appetite, and as our previous presenter spoke about appetite nature versus nurture, you want to look at that PowerPoint presentation to see what are the contributing factors to obesity. It also is contributed by lack of exercise and an increase in metabolic efficiency. So in the person who is obese, there's a build up of fat in the tissues, which causes low-grade inflammation in the body. This leads to insulin resistance and causes the individual to be unable to use that insulin to reduce the glucose in the body, and this leads to type 2 diabetes. Let's look at obesity and cancer. Most individuals assume that cancer is mostly hereditary, or I can't get cancer because I don't smoke, drink, or have an unhealthy lifestyle. So cancer is nothing that I will get. But persons who are obese do develop cancer because of low level inflammation causing the DNA to be damaged. This leads to cancer. Persons who are overweight and obese are more likely than normal weight individuals to have conditions or disorders that are linked to or that can cause local inflammation and are at risk for certain cancers. For example, chronic low inflammation induced by gastroesophageal reflux disease or Barrett esophagus is a likely cause of esophageal adenocarcinoma. I'll be spending a little time on cancer today because obesity contributes to a lot of cancers, as you will see as I go along in the presentation. Obesity is a risk factor for gallstones and a condition which is characterized by chronic gallbladder inflammation, and this leads to gallbladder cancer. It also contributes to chronic ulcerative colitis, a chronic inflammation condition, and hepatitis, and these lead to different types of liver cancer. The fatty tissue or adipose tissue produces an excess amount of estrogen, and high levels of which have been associated with increased risk of breast, endometrial, ovarian, and other cancers. Persons who are obese have often increased blood levels of insulin and insulin-like factor, which develops into colon, kidney, prostate, and endometrial cancer. The fatty cells also produce hormones and inhibit cell growth, which leads to various types of blood cancers. Fatty cells also have direct and indirect effects on other cell growth regulators, including the mTOR and AMT activator protein kinase, and these are what causes cancer. Let's look at the different types of cancers which are associated with overweight and obesity. So we have endometrial cancer. Endometrial cancer is 2 to 4 times more likely to occur in obese and overweight women than in women with normal weight. Extremely obese women are about 7 times as likely to develop the more common of the 2 main types of this cancer. The risk of endometrial cancer increases with increasing weight gain in adulthood, especially with women who are menopausal. Then we have esophageal cancer or adenocarcinoma, located in the esophagus right here. Persons who are overweight or obese are twice as likely as normal people to develop a type of esophageal cancer which is known as adenocarcinoma. And persons who are extremely obese are more than 4 times as likely to develop this type of cancer. Gastric cancer. This type of cancer is twice as likely to develop in persons who are obese than persons who are of normal weight. Next, we have liver cancer. Liver cancer is twice as likely to develop in persons who are overweight or obese than persons who have normal weight. The association between overweight and obesity and liver cancer is stronger in men than in women. This is from the National Cancer Institute. Kidney cancer. Persons who are overweight or obese are nearly twice as likely as normal persons with normal weight to develop renal cell cancer, the most common form of kidney cancer. And the association of renal cell cancer with obesity is independent of its association with high blood pressure, which is a known risk factor for kidney cancer. So although high blood pressure is a risk factor of kidney cancer, being overweight is also a very strong risk factor. Multiple myeloma. Compared with normal weight individuals, overweight and obese individuals have a 10 to 20% increase in the risk of developing multiple myeloma, which is seen on the skin. Meningioma. This type of cancer is located in the brain. It is a tumor, cancer in the tissue covering the brain and spinal cord. And this type of cancer, the risk of this slow-growing brain tumor that arises in the membrane surrounding the brain and the spinal cord is increased by 50% in persons who are obese and about 20% in persons who are overweight. Next, we look at pancreatic cancer. Pancreatic cancer is 1.5 times more likely to develop in persons who are obese and overweight than persons who are in normal weight. Colorectal cancer, sorry. Persons who are obese and overweight have 30% more likely to develop colorectal cancer than normal weight persons. Once your BMI is higher, it is an increased risk of colon and rectal cancers in both men and women, but the increase are higher in men than in women. So men are more likely to get colon and rectal cancer if the BMI is very high or if they're obese. Gallbladder cancer. Compared with normal weight persons, people who are overweight have a 20% increase in risk of gallbladder cancer, and people who are obese have a 60% increase in risk of gallbladder cancer. The risk increase is greater in women than in men. Let's look at breast cancer now, one of the most common cancers here in Trinidad and Tobago. So for breast cancer, many studies have shown that in postmenopausal women, a higher BMI is associated with a modest increase in the risk of breast cancer. For example, a 5-unit increase in BMI is associated with a 12% increase in risk. Among postmenopausal women, those who are obese have a 20% to 40% increase in risk of developing breast cancer compared with normal weight women. The higher risks are seen mainly in women who have never used menopausal hormonal therapy and for tumors that express hormone receptors. Obesity is also a risk factor for breast cancer in women. So most commonly, we see breast cancer in females, but men also develop breast cancer. In premenopausal women, by contrast, overweight and obesity have been found to be associated with a 20% decreased risk of breast tumors than express hormone receptors. So breast cancer is common in both males and female. This is why it is very important for women to get that mammogram test done. Ovarian cancer, another common one. Ovarian cancer, the higher the BMI is associated with a slight increase in the risk of ovarian cancer, particularly in women who have never used menopausal hormonal therapy. For example, a 5-unit increase in BMI is associated with a 10% increase in risk among women who have never used menopausal hormonal therapy. And the last one we look at is thyroid cancer. Thyroid cancer, the higher the BMI, is associated with about a 10% increase in the risk of thyroid cancer. So we can see from this diagram here that almost every part of the body has some type of cancer associated with it, and this can be related to being overweight or obese. So just to summarize, the different types of cancers associated with obesity are endometrial, gastric, cardiac, kidney, meningioma, multiple myeloma, liver, esophageal adenocarcinoma, pancreatic, gallbladder, ovarian, colorectal, breast, and the thyroid. In conclusion, obesity is a major contributor to many health illnesses. Therefore, ensuring that our weight is controlled can significantly reduce the risk of developing illnesses. And I want to leave this admonition with you, which was given to us in the Ministry of Healing, chapter 23. Our bodies are Christ's purchased possession, and we are not at liberty to do with them as we please. All who understand the laws of good health should realize their obligation to obey these laws which God has established in their being. Obedience to the laws of health is to be made a matter of personal duty. We ourselves must suffer the results of violated law. We must individually answer to God for our habits and practices. Therefore, the question with us is not what's in the world's practice, but how shall I, as an individual, treat the habitation that God has given to me? As I close, I want to encourage you to invest in your health and look out for our next presentation on childhood obesity.